2021-22 was certainly a great year for Greater Manchester Mental Health NHS Foundation Trust. We have a lot of insights to share with you in this short film that will explain what we have achieved over the last 12 months. As a publicly funded organisation, GMMH must produce a set of accounts every year, which are then independently audited. This ensures there is a true and fair representation of our finances, demonstrates how we are offering value for money, and evidences that we are well equipped to continue our operational activities. By reviewing our 2021-22 finances, not only do we ensure we are ready for the next financial year, but it also gives us an opportunity to look back at our achievements. About the accounts. Our accounts are prepared in line with international accounting standards and Department of Health and Social Care guidance. KPMG are the Trust's appointed external auditors. For 2021-22, they gave the Trust an unqualified audit opinion, which confirms that our accounts met all the necessary requirements, including a true and fair view with sound financial control, value for money, and financial sustainability. In summary, it gives you confidence that we're looking after the money the way we should and spending it wisely. A wonderful validation for our Trust. Their audit report was then included within our Trust annual report and accounts, which were laid before Parliament in advance of being made publicly available. You can get a copy on our Trust website. Where does our money come from? In 2021-22, GMMH received the majority of its income from 5 main clinical commissioning groups, or CCGs: Manchester, Bolton, Salford, Trafford and Wigan, as well as from NHS England, Health Education England, Research and Innovation Grants and local authorities. CCGs, £284 million. NHS England, £107 million. Local authorities, £22 million. Health Education England, £19 million. Research and Innovation, £6 million. Other, £17 million. In total, for 2021-22, we received £455 million in income, which is an increase of £81 million compared to last year. What did we spend it on? Things that we spend our income on are called expenditure. In 2021-22, we spent £456.5 million. So, against an income of £455 million, this created a deficit of £1.5 million. But don't panic. This was the result of having to include a technical accounting adjustment within our costs, relating to the annual revaluation of our land and buildings. We have to value all of our estate every year to reflect the current market and prices. So, whilst it's a cost in the accounts, we don't actually have to pay out any cash on it. Deducting this gives us an overall break-even position for the 2021-22 financial year. As always, the majority of our expenditure was for staff salaries, £322 million to be exact. After all, GMMH wouldn't exist without you. Other elements of expenditure included purchase of healthcare from other organisations, clinical supplies and services including drug costs and premises and utilities costs. During 2021-22, we also invested £13.2 million of capital funding into our estates and IT infrastructure. Capital funding is for items that are £5,000 or over in value. Every year, we are set a limit of the amount of capital we can spend. Over 2/3 of this funding came from our own cash, with an additional £4.7 million being funded by the Department of Health and Social Care. £7.5 million of this investment went into improving our buildings and outdoor spaces. The other £5.7 million was for digital or IT and was to purchase new devices, improve our IT infrastructure, and upgrade cybersecurity to help prevent any data security breaches and to protect your data. Improvements have been made to our health and safety compliance, clinical systems and e-prescribing, and the Wi-Fi in our buildings. We are also working to bring Wigan services onto our clinical information system, Paris, and we have financed new devices for their services ahead of this transfer. We also invested in the refurbishment and upgrade of our seclusion rooms as part of our commitment to our patients' care, as well as opening a new spiritual care hub, a great space for our staff to use for their spiritual care and well-being. What else did we achieve? Our trust has accomplished a lot this year. We successfully transferred Wigan Borough Mental Health Services into the GMMH family and became the lead provider for low secure and medium secure services across the North West. The final business case for Northview Development in North Manchester was approved and work is now underway, which will be a major development for GMMH and will transform inpatient mental health care for those communities. Our finance team achieved Level 3 accreditation, which recognises excellence in finance and is awarded to just a handful of organisations across the country. Final thoughts. After the challenging year we had in 2020-21, the Trust is incredibly proud of how the organisation has continued to improve, to grow, and to put the welfare of our patients above all else. We know that none of this would have been possible without the hard work, diligence, and passion of our staff, so let us take this opportunity to say thank you. Hopefully, this film has made our finances clear and easy to understand. But if you have any questions, please let us know or visit our intranet or website to find out more.